Hi, my name is Sydney Mershimer, and for my capstone, I am proposing using tenecteplase instead of alteplase will increase good patient outcomes. So in order to make this big change, we need to first start out with how leadership will propose the change. Leadership's responsibility is to use Lewin's theory of change would be the best way to propose it. That will get staff, family, and patient input. It will make everybody feel as though they are accepted and they are heard, and that will later lead to better outcomes and more reception whenever the change is put into place. Leadership will also begin daily plans of care. They will begin passing them out, and that will have electrolyte labs. It will have the plan for the day, what the plan for the patient is. That way, patient is in the loop, family is in the loop, and it's not all just on nursing to continue to remind them, but they have a hard printout copy that will show them exactly what the plan is. As for tenecteplase as a whole, tenecteplase seems to be more clinically efficient than alteplase. It's a 4.5 window from the onset of stroke symptoms. It has a longer half-life than alteplase, so it works longer, but it's only one IV push medication administered over 30 seconds rather than an hour infusion with alteplase. It has a decreased risk of non-cerebral bleeding complications. So anything that has to do with not hemorrhaging, you have a decreased risk for. It's 1 hour of Q15 neuro checks. So every 15 minutes, the nurse needs to go in and do neuro checks on the patient who received tenecteplase. Versus with alteplase, it's 2 hours of Q15-minute neuro checks. I think that this will really increase patient satisfaction because they won't be woken up as much when they're trying to rest. And tenecteplase versus alteplase has a better 30-day recovery period. Technology-wise, patient-family communication is huge. With COVID and the pandemic going on today, communication has gotten really difficult. So phone or FaceTime for the patient to communicate with family if they're unable to come in, because one of the side effects that we're seeing of COVID is patients are stroking out due to risk factors before COVID. COVID exacerbates all of the risk factors and puts your body working really hard, and then people end up throwing clots. So when a patient comes into a comprehensive stroke center, the standards of a stroke center is they receive an education booklet on arrival. The care manager stops by the same day that they are admitted. They give them nearby support groups, pamphlets for information. They reassure the patient that they are not alone. They do not have to go through this alone. Also, comprehensive stroke standards. Door to CT in 45 minutes. So whether it's the ambulance bringing them or the family bringing them, as soon as they hit the door, less than 45 minutes, they need to be in the CT scanner. This is just to ensure that if we do have a last known well, we stay within that 4.5 hour range. If we don't have a last known well, we need to make sure that they're either their ischemic stroke or their hemorrhagic stroke, or they could be herniating. We just don't know until we get that CT scan. So getting it within the first 45 minutes is very, very important. Once that first 45 minutes is up and we're in the scanner and we're getting the scan, the radiologist reads the scan, the doctors read the scan, and then they form a plan of care. So if we have a last known well and it's less than 4.5 hours and they are a candidate for tenecteplase without having any other risk factors, if you've had a GI bleed recently, there are a lot of risk factors that you can't get tenecteplase for. But if they meet any of the criteria, they need to be from the door to interventional radiology in 1.5 hours. So that really only gives you about 30 minutes after the CT scan to read the CT and really formulate a plan. If they're a hemorrhagic stroke, we do not take them to interventional radiology unless they are herniating. They'll go directly to the OR and have a cranioplasty done. More with the CT. The CT is the best technology that we have for today in diagnosing strokes, and it will show where the strokes occurred, what type of stroke it is, and how much brain matter has been affected. So one of the big things whenever people have strokes is they have the stroke and a lot of the brain tissue around the area that they stroked has died, which is called a mass effect. When you get a mass effect, that's when people have severe neurologic deficits. Having a severe neurologic deficit makes you a great candidate for TPA if we have a last known well. Or they can go in for an angiogram and take out the clot later on if you're stable. Just knowing what has happened and that CT allowing you to do that. Sometimes providers, if you're not in the time frame for tenecteplase, sometimes they want an MRI to see an even more in-depth picture. We try to stay away from MRIs though because they are more radiation and they take longer. They take about 45 minutes versus the 5 minutes that a CT scan takes. So once again, I'm proposing the tenecteplase because it will increase good patient outcomes. Less of a chance of non-hemorrhagic side effects. It has a better 30-day recovery rate. And this will benefit the patients and the family because when the patient recovers better, it's less family strain that's placed. It's all about balance. Having stroke certified nurses taking care of these patients is huge. That is so important because it increases the understanding, and patient care is improved. When nurses and doctors understand the dosages, the actual what each medication is used for, and the timeframes in which they can be used, that makes life so much easier. It makes it easier for the doctors to order things more quickly, and it makes it easier for the nurses to catch mistakes easier. Because if you're doing it all the time, you see a trend in how things are ordered, and then if you see something that's not quite right, you have more of a willingness to say something versus when you're brand new to this and you're not really sure what's going on and you aren't properly educated, you could be administering the wrong medication. So just getting that continuum of care down a little bit better would really seem to help outcomes. The literature states that when taking a patient to the comprehensive stroke center, like I said, 45 minutes, door to CT, and 45 minutes. Side effects of tenecteplase are very few. Like I said, you have less of a chance of having any side effect other than the hemorrhagic stroke happens with 0.1% of patients with tenecteplase and alteplase. So that is a pretty devastating side effect. That's why we do Q15-minute neurochecks, just to ensure that the patient doesn't have any negative side effects. So I personally believe that tenecteplase will positively impact patient outcomes due to less NIHs. It's an IV push versus an hour-long infusion, a better 30-day recovery rate. Therefore, I believe my capstone matched my initial prediction of tenecteplase and will improve patients and family experience in the hospital and after discharge. Having a whole care, just thinking of all the aspects for a stroke patient are huge. It is such a change in lifestyle for so many people. We see it all the time. I believe over the course of my bachelor's, I've developed much better speaking and writing skills. I've also learned how to effectively analyze literature and talk about it. I've expanded my knowledge on strokes, which is great because that's what I do every day for a living. I work in a neuro ICU in Pittsburgh, PA. And so I've just become a better nurse because of it, because I understand what I'm taking care of, because I know what I'm looking for, because I know what strokes do to people and how they debilitate them and what kind of support that they need. I also have learned how important it is to keep up and continue challenging evidence-based practice, because evidence-based practice is only relevant for so long until new technology comes out and new medications have been tested, and we just have to keep comparing what we're using and make sure that we're the most up to date. Thank you.